Tēnā koutou, tēnā koutou, tēnā koutou katoa. Warm greetings, everybody. On behalf of our Health Promotion Forum team, I'm Sione Tuitahi. I'm the Executive Director. It's a pleasure and a privilege to welcome you all today as you turn off your camera and turn off your microphone, relax and sit back and enjoy the next hour and a half. Today's topic, very timely, very significant, and of course there's a great sense of urgency that comes with the theme of today: no health without planetary health. And our speaker for today, we are very thankful for his generosity, Dr. Trevor Hancock, retired professor in public health in Canada, Victoria, and of course Trevor will say a few more things about himself and his work. But thanks to his generosity and of course to technology, that we are able to have this conversation with him about the health of the planet, which is directly related to our own well-being as fellow human beings, whether it's for us here in New Zealand or other parts of the world. And without, just one more thing to say, that Trevor will be presenting for around 45 minutes, and the remaining 45 minutes, you're welcome to turn on your camera if you wish to, and interact with Trevor, and Lavinia will convey your questions. So it's a 1.5 hour session. Again, warm welcome to you all. Without any further ado, I'll hand over to you, Trevor, for your presentation. Thank you.
Thank you, Sione, and kia ora, everybody. It's a pleasure to be back in New Zealand again, at least virtually. Of course, I was at the IUHPE conference in Rotorua, almost 2 years ago now. Goodness, time flies. So as Sione said, I'm going to be talking today about the topic of no health without a healthy planet, and covering a lot of ground fairly quickly. The PowerPoint will be available to you afterwards, and then we can have a discussion. I'm not going to say a lot about myself, but I am a member of a global working group that Sione chairs on behalf of the IUHPE, which came out of the conference in Rotorua. And it's a working group called Waiora Planetary Health Promotion. So that's really what I'm going to be covering. So I'm just going to switch to share my screen, and we will get this show on the road. And it always takes a moment or so for the technology to catch up. And there we go. So I want to just begin with the Territory Acknowledgement, which is something we do now a lot here in Canada, and I know elsewhere around the world. And where I'm speaking from is the territory of the Lekwungen peoples, the Songhees, the Esquimalt, and the Wasanich people, whose historical relationships with the land continue to this day. And these acknowledgements, I think, are more than just token. They're very important to recognize the long history of relationship with the land for thousands of years before European settlers arrived only a couple of hundred years ago, about the same time actually as in New Zealand. So I'm going to talk about these 6 things today. The challenge we face, the Anthropocene itself, what this means for health and for health promotion, what the role of health promoters can be, and then end by the notion that we really should be talking about this. And one of my big concerns is we're not talking about this. We talk about climate change, but we don't talk about these bigger problems. So in terms of the challenge we face, the UN Secretary General Antonio Guterres just a couple of months ago spoke at Columbia University's World Leaders Forum, and his talk was billed as a State of the Planet speech. And this is what he said: the state of the planet is broken. Humanity is waging war on nature. This is suicidal. I can't think of any better, more succinct way to put the situation that we're in front and center. But also what's important is he says that, of course, it's human activities that are at the root of this descent to what he called as a descent towards chaos. But he added, that means human action can help solve it. And that, of course, is where we come in. This is also something that is recognized by the Director General of the World Health Assembly, of the World Health Organization, rather, Dr. Ghebreyesus. And he, in speaking at the World Health Assembly about a year ago now, not quite, said that we have to protect, preserve the source of human health, which is nature. And I will come back to this notion that, of course, air, water, food, the most essential determinants of our health, all come from nature. They're not something we manufacture out of nothing. And then a third aspect of this, which is very much something that our global working group is focused on, is the indigenous worldviews, because part of what we're going to have to do is to have a real shift in consciousness and a shift in our core values from seeing ourselves as separate from and outside of nature, and nature is just some inanimate thing that we use, to seeing ourselves as fully embedded within nature. And that is a core feature of indigenous worldviews. And this actually comes from the Indigenous Peoples Statement for Planetary Health and Sustainable Development that came out of the Rotorua conference. And you can read it for yourselves, but this notion of the Mother Earth as a living being, and I don't actually have a slide about this, but of course what's really interesting is that this actually relates to what's known in Western science as the Gaia hypothesis, which was proposed by a planetary scientist called James Lovelock about 40 or 50 years ago now. The notion from a scientific planetary science point of view that the Earth is a living entity, which he called Gaia. So we're beginning to see how very old traditions of knowledge and very new knowledge actually are really saying the same thing. And so this notion that we are alongside our relations in the natural world, one of the things that Indigenous people here say in blessings is they refer to all our relations. And when they say all our relations, they mean all the other species, not their family in the human sense, but their family in the much wider sense of the birds and the fish and the animals and the plants and so on. Those are all our relations. So these are really background, if you like, to the conversation I want to have. But what does it mean for us in health promotion if the Earth is our mother, if we are part of Mother Earth's ecosystems, if nature is the source of human health, but that the planet is broken and that human action can help solve this problem? And in a sense, that is the process of thinking I want to take us through in the next half hour or a bit more. So first of all, this notion of the Anthropocene. If you haven't come across the term, it's one you should get used to. If you haven't seen this short video, and if you just Google "Welcome to the Anthropocene" on YouTube or Vimeo, you will find this. It was actually made in 2012. I'm not going to show it, but it's about a 4-minute video, but well worth watching because it summarizes very succinctly the challenge of the Anthropocene. But the Anthropocene itself is really 3 things. It is, first of all, a geological phenomenon. It has been suggested that it is a new geological epoch, one that replaces the Holocene, which is the period since the end of the last ice age, 11 or 12,000 years ago, during which all of what we think of as civilization and what we think of as, well, certainly agriculture and cities and all of that have all happened in the Holocene. And we're now moving out of that geological epoch into a new geological epoch. So millions of years in the future, there will be, if there are still geologists around, they'll be able to find a layer in the rocks, which is the beginning of the Anthropocene, which is us. Because of course, anthropos is the old Greek word for humans. But those new layers reflect, in fact, a set of massive and rapid global ecological changes. So it's an ecological phenomenon that is then being picked up in the layers that are being laid down. And finally, of course, it's a human phenomenon, because we are the anthropos, or more precisely, some of us are. That is to say, primarily high-income countries, Western industrialized, not just Western, but industrialized countries that have had the largest impact and have had so since at least the early 19th century. So there are these three things wrapped up in the idea of the anthropos: the scientific notion of a geological phenomenon, reflecting a set of ecological changes that are in fact human driven. So geologically, we're actually seeing new things such as aluminum and tungsten carbide and glass and plastic and concrete, things that don't exist in nature, that you'll be able to find. When you look in millions of years at these layers, you'll be able to find higher levels of CO2, of nitrogen. POPs are persistent organic pollutants, and radioactive particles that don't occur in nature unless we make them. And all of those are other markers of our presence. But I think the most troubling one is that third set of factors at the bottom, that we are changing fossil assemblages. So if you think about the last great extinction, when the dinosaurs disappeared, what tells us that is that the changes in the fossils, the dinosaurs disappeared from the fossil record. Well, if you come back in millions of years' time, you will find that now humans are a third of the mass of all land vertebrates, and our domesticated species, cattle and pigs and sheep and horses and chickens and so on, they are 2/3 of land vertebrates, and wild species now are less than 5%. So we have largely extinguished wild species in the fossil record. And that will be a very obvious marker of our presence many years into the future. Then I mentioned that it's a geologic epoch, so the Anthropocene Working Group of the International Commission on Stratigraphy voted that there is such a thing called the Anthropocene about almost 2 years ago now, and that they suggested its base was around the mid-20th century of the Common Era, that is to say around 1950, which was when I was born, roughly. I was born in 1948. So I am the Anthropocene, if you like. Now, it certainly includes climate change. So we have been talking a lot in recent decades about, particularly recent years, about the climate change. But what's really important to understand is that the Anthropocene is much more than just climate change, important though that is. It includes ocean acidification and ozone layer depletion, resource depletion, both renewable resources and non-renewable resources are being depleted. Pollution and ecotoxicity. Ecotoxicity is that phenomenon of persistent organic pollutants that contaminate food chains and in fact contaminate us. We all carry a body burden of persistent organic pollutants, which is a brand new phenomenon for humans. And then we are seeing a sixth great extinction. And all of these are happening at the same time. And so many people are beginning to recognize, as the UN Secretary General did, that this constitutes an existential challenge to humanity. And it is both the scale of that challenge and the rapidity of that change that matters. So this is not just very large scale change, but it's very rapid change. We are crossing planetary boundaries. This is a report from 2015. Will Stephan is one of the key thought leaders in this whole area. You will see his name crop up several times in this presentation. He's based at ANU in Canberra. We're crossing planetary boundaries into areas that are defined as high risk, beyond the zone of uncertainty. Already we've done so for biogeochemical flows of phosphorus and nitrogen and for species extinctions. We are in a yellow zone of increasing risk for land system change and climate change, approaching that for ocean acidification. And so we're crossing boundaries into areas of high risk that we really shouldn't be crossing in a number of these major Earth systems. And all of this is driven by three powerful forces. First of all, GDP. So global GDP grew 11-fold since I was born. and that is in standard sort of international adjusted dollars. So it grew 11-fold. Population grew 3-fold. So actually GDP grew about 4-fold per capita, and then population grew 3-fold. And all of this enabled by the power of our technology, which is mining and fossil fuel use, and our ability to hoover up fish in the ocean, and the persistent organic pollutants I mentioned, and plastic nanoparticles. All of these are global impacts of our technologies. And it's happened very rapidly. So on the left, you see a set of socioeconomic changes, and on the right, a set of Earth system changes. And the red arrow and dotted line in all those charts indicates 1950. And you will see that for many of the driving forces on the left, there's been a tremendous upkick in activity and in impact since 1950. Look at real GDP, top center. Look at international tourism, bottom right, and so on. And then you can see the impact that is having on the Earth. And again, in many cases, the so-called hockey stick phenomenon in these charts. Carbon dioxide already had been increasing since the 1750s, but really boosted after 1950. Look at stratospheric ozone behind that, or marine fish capture below that. So very rapid as well as massive changes are happening. And this is decimating vertebrates, as I already indicated. So this is not about species, this is about populations of species. So it's the actual count of numbers of animals. And for a set of 4,300 different vertebrates that are monitored across the planet, there's been a 68% decline in their count just since 1970. We don't have data before 1970. And it's down 94% in Latin America. That is beyond troubling. That is devastating. And it's also down 84% in freshwater vertebrates. So we're seeing some massive changes. We are exceeding the Earth's biocapacity. So we passed the sort of one planet limit of world biocapacity in about 1970. The dotted line is world biocapacity, which has gone up a little bit per person, or overall rather, simply because we've been pouring phosphorus and nitrogen into the earth and expanding agriculture. But our footprint is now about 1.7 planets worth since 1960. So the result of all this is here in Canada, we behave as if we have 4.7 planets. That's our ecological footprint. And of course, in New Zealand, you act as if you have 3 planets worth, just about 2.9 planets. The footprint for Aotearoa, New Zealand is 2.9 planets. But of course, what we actually have is just this one planet. So this, in a nutshell, is the problem we face, and why a lot of my work is around this notion of what we call one planet living, one planet communities, and so on. So to get to a one planet Canada, which is our fair share of the Earth's biocapacity, not the 4.75 planets worth that we currently take, is going to mean an almost 80% reduction in our ecological footprint, which is huge. Although about a half of that footprint, maybe a bit more, 60%, is carbon, is fossil fuels. For you, it means a 67% reduction. From just about 3 planets worth, you need to reduce 67% to get down to 1 planet's worth. But from our point of view, as people interested in health and well-being, the challenge is, how do we do that while at the same time meeting basic needs and ensuring high levels of human and social development and good health for everyone? So we don't want to reduce our footprint in a way that destroys the quality of life and health for many people, but that is the danger. So the grand challenge we face as a society, as a civilization, as a planet, as a species, as humanity, is how do we live equitably in harmony with each other and with nature and in good health on this one small planet. And that, to me, is the ultimate challenge, among others, for health promotion. So what does all this mean for health? Well, I'm not going to go into all of the details. There are reports out there that you can read that discuss the details, but it was recognized as far back as 2005, so more than 15 years ago, by the Millennium Ecosystem Assessment set up by the UN Secretary General at that time, that the ability of the planet's ecosystems to sustain future generations can no longer be taken for granted. That is a very scary statement. So about 5 years ago, well, actually started about 9 years ago, I, together with my colleagues working within a working group of the Canadian Public Health Association, developed a report called Addressing the Ecological Determinants of Health. So many of you will know about all the time and energy we have spent focused on the social determinants, as indeed we should. But we need to recognize that in addition to the social determinants of health, there are the ecological determinants of health. And they are in many ways the most fundamental determinants. I already mentioned, where does air, water, and food come from? How about all of the materials for everything you see around you? What about the fuels that power our ability to talk right now? What about the way that the ozone layer protects us from UV radiation, or the way that nature decomposes and recycles many of our wastes? And the fact that, in fact, we've had a relatively stable and benign climate since the end of the last ice age, 11,000 years ago. All of those are ecological determinants fundamental to our health and well-being. And so it is those that we are disrupting. And these fundamental determinants of health, if we disrupt them, we are in deep trouble. So around the same time, the Lancet, together with the Rockefeller Foundation, had created a commission on what the Lancet has been calling for some years now, planetary health. And you will see here that they define planetary health as the health of human civilization and the state of the natural systems on which it depends. So this is the business that I see myself in, and our working group that Sione chairs sees itself in, which is the business of planetary health. As health promoters, we talk about planetary health promotion. So that Rockefeller Lancet Commission said, we have been mortgaging the health of future generations to realize economic and development gains in the present. So we're realizing gains now, but we're putting in peril future generations, which of course was Antonio Guterres's point that I started out with. So this is another statement on to the same effect from an intergovernmental science platform that is essentially the biodiversity version of the Intergovernmental Panel on Climate Change. We are eroding the very foundations of our economies, livelihoods, food security, health, and quality of life worldwide a year ago, getting on for 2 years ago now, when they reported. So that is what all this it means for health. It threatens the very basis of the health of the human population on Earth. That's the situation we face. So what does it mean for health promotion? Well, I want to suggest two areas that we should focus on. The first is systems transformation, and all of the work that has been done, for example, in areas of healthy public policy or health in all policies or governance for health. Those are part of systems transformation. And then at a local level, the notion of healthy, what I call healthy communities 2.0, which was the topic of my talk at the IUHP conference a couple of years ago now. So in terms of systems transformation, I always find this very helpful. This is actually comes out of systems engineering thinking, but it was framed very nicely by a US organization called the Institute for Healthcare Improvement. And they said every system is perfectly designed to get the results it gets. So it's used in healthcare, for example, to help understand why you have patient error, or why you have medical error rather, and why you have declines in patient quality care. And what they're really, and the same approach actually is used in investigating airplane crashes and things like that. You have to look at the system, and if the plane crashes, or if you had a lot of adverse patient outcomes, or if you are busy destroying the planet's or our ecological determinants of health, that's because the system is actually designed to do exactly that. Not intentionally, quite unintentionally, but that's what's happening. So you have to change the system. So if our current system is perfectly designed to plunder the planet and undermine the Earth systems that underpin our health, and at the same time to create what I would consider to be obscene levels of inequality and impoverishment that we know impair health and shorten lives for millions of people around the world, that system is perfectly designed to do that. So if we want to address the ecological determinants of health, or we want to address the social determinants of health, we're going to have to change the system that leads to those outcomes. So to get different results, we must change the system. But we're running out of time. So in an earlier talk, an article actually in the New York Times about almost a year ago now, this is what Guterres had to say at that point. Human conduct is distorting ecosystem processes. We're close to running out of time. We're approaching a point of no return for human health, which depends on planetary health. So in some ways, my whole talk is about that phrase. We are close to running out of time, approaching a point of no return for human health, which depends on planetary health. We have to understand and act as if this were the case. Will Stephan, about a year ago now, a little more than that, in an interview about some work he was doing, said this, which is crucial to our understanding from the point of view of health promotion. We need, he said, to reach a social tipping point before we reach a planetary one. So as Guterres said, we're running out of time. We're approaching a point of no return. That's a tipping point. But Will Stephan made the point, which harkens back to Guterres's earliest point that I made, that human action has caused this, so human action can fix it, that we need to reach a social tipping point. We need social change before we hit the wall on planetary change. And actually, in health promotion, in many ways, that's what we do. The most obvious example in recent decades has been around tobacco, where we reached a social tipping point where suddenly it was socially unacceptable to smoke and to be smoking in public. We reached a social tipping point around wearing masks and being socially distanced as a result of COVID. And so social tipping points happen all the time. We just need to figure out how we can help make them happen in the right way. So here are some key transformative changes, and I'm going to very lightly touch on them. It's based on a long article I wrote in a journal called Challenges, which talked about the need to get beyond what I call head stuff, only thinking about this, to get into mind and spirit stuff. So how do we elevate this from being an intellectual concern to being an emotional concern and a spiritual concern? So we're going to have some form of cultural evolution, some core values shift. Spirituality, we need to re-establish a reverence for nature. We need to go back to that notion of the earth as our mother, and that we are part of the earth, and that all our relations includes all those other species. Then we need to use the kind of tools we have as a society, legal tools, social justice and tools, economic tools to create change. And I'm going to touch very lightly on some of these. I've already mentioned this, and in the Indigenous Peoples Statement in Waiora, the relationship with the natural world is characterized by reverence and values that include sustainability, guardianship, and love. Love isn't a word you hear very often when we talk about health. It probably should be, and it certainly should be when we talk not only about other people, but about nature too. So how do we reestablish a reverence for nature? What is the role of faith communities in doing that? How do we in health promotion link up with them, work with them, help that to happen? I mentioned Gaia earlier. For the Greeks, Gaia was the goddess of the earth, and you find in every culture there is something equivalent to what the Greeks called Gaia. And here are some of those other expressions of that. Whenua, Te Whenua, Pachamama in Peru and other parts of Latin America, Erde, a spirit, an earth spirit, in fact, in Wagner's of the Ring, and so on. And so pretty much every culture has some version of an Earth Mother sort of spirit. And then, of course, I already mentioned this, that in the 1970s, James Lovelock proposed that the Earth is a self-regulating system, and the Amsterdam Declaration on Earth System Science in 2001 said the Earth system behaves as a single self-regulating system comprised of physical, chemical, biological, and human components. So we are part of the Earth system, and we need to start understanding that and thinking that way, and then acting that way. Then there are legal and ethical approaches. So how about the right to a healthy environment? It is in many countries, it's part of their founding documents or built into their constitution, particularly not in Anglo-Saxon countries. So it's not present in Canada, the US, the UK, New Zealand, I believe. I think it may now be in Australia. That we're not the only countries by a long chalk, but there's a number of countries that do not include the right to a healthy environment for citizens. So you don't actually have a right to healthy air or healthy water, clean water. That seems ridiculous. Then, of course, there's a second set of rights we need to be thinking about. We need to expand our notion of rights to future generations. Do the future generations not have a right to a healthy environment? Or are we, as the Rockefeller-Lancet Commission put it, mortgaging their future? So we need to think about intergenerational rights. In Wales, back 5-6 years ago now, they brought in a Wellbeing of Future Generations Act, and they actually have a Future Generations Commissioner. I think every country in the world should have a Future Generations Commissioner and a Wellbeing of Future Generations Act. Then there are interspecies rights, the right of other species and indeed entire ecosystems to exist. And right there in Aotearoa, New Zealand, you are leading the pack. You've granted legal recognition as persons both to the Wanganui River and the Te Urewera region. And we heard very movingly from, I'm afraid I forget his name, but a speaker from Te Urewera about that at the IUHP conference. It was a very moving presentation, a very powerful presentation. And then there is even discussion at the World Criminal Court about establishing the idea of environmental crimes against humanity. So lots of legal ways we need to be thinking about how we change our legal approaches. And then we very much need to change our economic processes. Remember, the global GDP grew 11-fold in my lifetime. If it grows at 2% a year, which is a modest target from many countries, then over the course of 70 years, it will increase a further 4-fold. So from now, 70 years ahead, will be 4 times bigger than it is right now at 2% annual growth, which makes it 44 times bigger than it was when I was born. These are massive, massive changes and unsustainable if it means exploiting the same resources in the same way as we do with our present economy. So what sort of economy can meet the goal of achieving good health and a good quality of life for everyone while living within the biophysical and ecological constraints of our one small planet, our home? That is the challenge for economics in the 21st century, one that is barely beginning to look at. Some of you may have heard of this, and I hope that many of you will go take a look at it. This is donut economics, created by Kate Raworth and international development economist, now working at Oxford, having worked for Oxfam for many years. And her idea is really very simple. The inner dark green circle describes within it a social foundation, essentially the socially related goals of the SDGs. So what everyone should have some basic needs: water, food, health, education, energy, and so on. You can see them here. But our economy can't exceed the outer dark green circle, which is what she calls the ecological ceiling. So we can't disrupt those Earth systems that I mentioned earlier that we're already crossing boundaries on. In fact, we're beyond the ecological ceiling on biodiversity loss, on nitrogen and phosphorus loading. We're approaching it for climate change and so on. So we have to exist, or our economy has to exist, in what she calls a safe and just space for humanity, which is the donut. So big enough to ensure a social determinants of health are met, but small enough that we don't exceed the ecological ceiling. That is economics for the 21st century. That's where we have to go. And of course, again, in New Zealand, in Aotearoa, you're actually setting the stage for some of this. So your government introduced the notion of a well-being budget back at almost a little over 2 years ago now. A well-being focus to drive the decisions we make. And so your government is looking at that. They have a living standards framework, which includes not just economic capital, or as it's called here, financial and physical capital, but human capital and natural capital and social capital. And when I get to talk to businesses, which I don't very often, but when I do, I say real capitalists in the 21st century will grow all four forms of capital at the same time. And if you're only growing one form, financial and physical capital, GDP, but at the same time damaging natural capital or social capital or human capital, and particularly natural capital, of course, if you're doing that, then you're not a real capitalist in the 21st century. And this is not a suitable economy for the 21st century. Your government seems to get that, which is very encouraging. And then, as Guterres said in his speech a couple of months ago, making peace with nature is the defining task of the 21st century. It must be the top priority for everyone, everywhere. And that, of course, I would say, must include health promotion. It must be our top priority. WHO has actually created a manifesto for a healthy recovery from COVID-19 and called for a healthy and green recovery that places the protection and restoration of nature at the center. So they're making that link between really a sustainable economy and health and nature. And these are the 6 prescriptions that are in their manifesto. The first of which, you'll recognize the terms again: preserve the source of human health, nature. And then you read on and you talk about clean energy in healthcare facilities and water and sanitation as essential services, a quick and healthy energy transition, which also we should add must be socially just, healthy and sustainable food systems, healthy and livable cities. These are strategies for a healthy and green recovery. And the last one, stop using taxpayers' money to fund pollution. That means very specifically, stop subsidizing the fossil fuel industry, which is massively subsidized by governments around the world today, and that has to stop. We don't want to be polluting the environment with fossil fuel emissions, with carbon dioxide and methane and so on. So stop supporting it financially. So the second set of choices has to do with healthy communities, and particularly what I call what others call one planet communities, and I call it Healthy Communities 2.0. So Bioregional is a UK-based organization that has been championing the notion of one planet living for 20 years now. Imagine a world where everyone everywhere lives happy, healthy lives within the limits of the planet, leaving space for wildlife and wilderness, all our relations. We call this one planet living, and we believe it's achievable. And they've been working on this for 20 years. You might want to check them out. Here locally, I've set up a small NGO called Conversations for a One Planet region. And we have a vision that our region will achieve social and ecological sustainability with a high quality of life and a long life and good health for all. So very much along the same sort of lines. And the good news from the point of view of health promoters is there are health co-benefits of becoming a one planet community, of becoming an ecologically sustainable community. These are the 10 principles that Bioregional has developed for one planet living. And I just want to emphasize that the first 3 are actually about people and community. So they're about health and happiness, equity and economy, culture and community. Before we get on to the more standard in sort of nature-based things such as land and water and food and transport and waste and energy and so on, the usual sustainable development issues. But first of all, it's about health and happiness, equity and economy, culture and community. Fits very nicely with health promotion, with healthy communities and all of that. And when we look locally, this is for Saanich is on the right, is the municipality where I live. Victoria is our neighboring municipality. When you look at our ecological footprint based on what people purchase, this is what you find. Food, transportation, buildings, and consumables are the main factors. And I'm not going to go into the detail of this. I'll leave you to look at the PowerPoint. But when we look within this, we see that meat, fish, eggs, and dairy are roughly 3/4 of our food footprint. Private vehicles, roughly 3/4 of our transportation footprint, and operating energy, roughly 3/4 of our building footprint. Those are areas where we need to focus our work, and they are also areas where there are health co-benefits. So there are health co-benefits of clean energy systems, such as reducing climate change and reducing air pollution. There are health co-benefits of moving to a low-meat diet with smaller portions, both in terms of reduced mortality and reduced obesity. There are health co-benefits of active and public transportation, not only in terms of reduced air pollution, but fewer injuries, increased physical activity, strengthened social connections. There are health co-benefits of reducing pollution and waste, and so on. So generally speaking, and it's been a rule of thumb for me for the 40 years or more I've worked in this area, getting on for 50, that anything that's good for the environment is usually good for human health. And so we need to find those health co-benefits. I'm not going to go into the detail of this, but Michael Pollan in Defense of Food said, eat food, not too much, mostly plants. That, I think, would be a good national food policy. It's supported by another Lancet commission that looked at food, planet and health. It's supported by the new Canada Food Guide, which emphasizes vegetables and fruits and whole grains and water as the drink of choice, and protein foods, but not simply meat and fish and eggs, but also legumes and nuts and so on. So there is much that we can do here. I've already mentioned the co-benefits of active or public transportation. I want to end, because I want to leave time for you to ask questions and have discussion, by talking about the role of health promoters as both health professionals within the healthcare system and as citizens. So as health professionals, learn about this stuff. If this is all new to you, there's certainly a wealth of material we can connect you to that will help you learn about this. We need to examine the health costs of our present way of life and the health co-benefits and potentially some health costs we should be aware of becoming a one planet community or region or city or country. We need to educate our peers and the public about all of this. And we need to work with local community organizations, with local municipalities, with local businesses, and try and work with them to create a one planet region. Within the healthcare system, educate other health professionals about this. Does your health authority, or whatever the equivalent would be in your country, Does it have an environment committee or a sustainability committee? Does it know its environmental impact? Has it done its ecological footprint? You can do the ecological footprint of a health system. It's been done. Does it have a climate action plan? Possibly. Does it have a One Planet action plan? I'd say almost definitely not. And does Aotearoa New Zealand have a coalition for green healthcare? I don't know the answer to that question. You can tell me. But certainly we have one in Canada. I co-founded it 20 years ago, the Canadian Coalition for Green Healthcare. Globally, there is Healthcare Without Harm is an international coalition around green healthcare. Remember, healthcare is about 10% of GDP. And that means that $1 in $10 is spent within healthcare, and about 10% of the footprint, maybe a bit less, of your country comes from healthcare. So it's a very large footprint, a very large environmental impact that we need to reduce. And then remember, you didn't give up citizenship when you became a health professional. So just because you're a health promoter doesn't mean you're no longer a citizen. And there are things you can and should do as a citizen. Join your local community association. Join relevant provincial, national NGOs. CANE is the Canadian Association of Nurses for the Environment. We also have the Canadian Association of Physicians for the Environment, which I co-founded 25 or 30 years ago. Have you spoken to your local councillor or your member of the legislature, if you have one, or your member of parliament about this? Write letters or write articles. Your local paper, local blogs are probably just looking for stuff. We have the conversation, healthy debate, other places. Maybe even run for election, especially locally. So there's lots you can do to get involved depending on how active you want to be. But finally, we need to be talking about this. So here in Greater Victoria, I mentioned our NGO, Conversations for a One Planet Region. We're about learning, discussing, and understanding, because if we don't do that, we don't think we can imagine or design or create a One Planet region. So we need to talk about it. And that's the business that we're in. And I'm going to just pass quickly over that. We're trying to now expand and deepen our conversation and connect it to others doing similar work. But we need to talk about this, and I'm delighted to have had the chance to talk with you about it. And now I will come to a close, and we've got 35 minutes or so for questions and discussion. Thank you very much.
Thank you very much, Trevor. And you have shared a lot. Our plates, I think I can safely say on behalf of the others, our plates are overflowing. You have succinctly stated the state of the planet by bringing your own wisdom and experience, but also drawing on the work of colleagues in the last 10, 20 years, so that we have a very clear picture of the emergency that we are in. And not only that, but you have also shared your own experience in your professional and citizenship journey, trying to address these issues, and again, bringing the evidences of science, the leadership and governance statements from the global level, UN, down to the local level, and offered also solutions, for us to examine. And it's wonderful also to see that you are keeping in touch with what's happening in New Zealand. And our colleague and friend from the Uruwerang, from Tuhoi, Tamati Gruga, will be delighted to know that you still remember his powerful presentation almost 2 years ago. A good example of his leadership, but also the work his community has done to preserve Mother Nature. And I can see that there are a few questions that people would like to ask you. And at this point, I invite all our participants, if you like to switch on your camera. I'm sure Trevor would like to see your beautiful faces as well. And feel free to do so. But I will pause there and hand it over to Lavinia Lavinia, who's fielding your questions and relaying it to Trevor.
Sione, and thank you for that wonderful presentation, Trevor. I've got two questions here. The first is from Grace Wong. Grace asks, what role will technology play? Will we be able to have clean ways of using cars and flying?
Very interesting question. There's all sorts of ways that technology can play a role. I mean, much though I would love to visit your country again, the fact that I can do this through the technology is very powerful and very useful. When it comes to things like cars, I think there's a couple of things. Certainly, we need to move as quickly as possible to clean energy for cars. And that means moving to electric vehicles, with a couple of warnings. The first warning is it depends where your electricity comes from. So if your electricity is generated by burning coal in the power plant, then you're not really any further ahead. In fact, since the efficiency of conversion of energy from coal to electricity and into the battery of your car is not very good, you may actually increase your carbon footprint. So you have to look not only at going electric, but going electric into a clean energy system. If you go into a coal-fired energy system, you're probably making things worse, not better. The second thing is moving people into cars into electric vehicles rather, solves two problems, potentially. It solves the problem of greenhouse gas emissions and it solves the problem of air pollution. Again, assuming that you're not burning coal to generate the electricity. It doesn't solve all of the other problems associated with cars. So you're still going to have lots of injuries and deaths from motor vehicle crashes. You're still going to have long commutes. You're still going to have all the stress that comes with that. You're still going to have a sedentary lifestyle. You're still going to have increased levels of obesity and so on. So we need to move beyond the idea that we get everyone into clean vehicles to say, well, how do we get them into active transportation? So biking, walking. So do you have a bicycle infrastructure? If any of you have been to places like the Netherlands or Denmark, you'll understand what a good bicycle infrastructure means and how big an impact it can have. But also, do we even need to make the trip? So for example, about half a mile from where I'm sitting, for the last 4 years, they've spent $100 million building a massive interchange to get rid of a traffic light on the highway from the western suburbs so that people can drive downtown more quickly. It's probably going to save them 5 or 10 minutes. It's a complete waste of money in my view. But what could have happened if you'd taken that $100 million and instead built 10 $10 million telecommute centers out in the western suburbs so that some people for some of the week could hop on their bikes or walk or take the bus or even drive a mile or two to their local telecommute center. And if you had a telecommute center, you're going to need a coffee shop, you're going to need daycare. Before you know it, you're building community as well. And so that would have been a much better use of the $100 million than this stupid interchange. So those are some of the ways. When it comes to flying, there is some work going on around converting to electric. I think that this whole COVID thing has taught us that we don't have to fly as much as we think we do. That's not going to solve the problem. It might solve the problem for some business travel. I still think there's some merit to getting in the same room physically with people, however. So I think we have to think about that. And globally, air travel right now is about 3% of global greenhouse gas emissions. So it's significant, but it's not where the major savings has been made. So it might be better to have savings elsewhere and be able to still fly. So those are some thoughts around that.
Thank you, Trevor. Food for thought. I have another question here from Susanna McHugh, who asks, how would you work with people populations that deny any of this is occurring. How would you suggest, as health professionals, we have the conversations with these people?
Maybe you don't. So, you know, there's an old saying about don't preach to the converted, but I've always had the flip side of that. Don't try preaching to the unconvertible. So it would be rather like saying, well, how do we sit down with the tobacco industry and have a conversation with them about tobacco? Or how do we sit down with committed smokers and have a conversation? The answer is you don't. It's not going to work to sit down and have a conversation with them. You have to work on the people who are open to change. You have to, in the case of the tobacco industry, oppose them actively, which is what we're now having to do with the fossil fuel industry. And very interestingly, and there's quite a body of work around this, the fossil fuel industry is using many of the same tactics that the tobacco industry did to cast doubt on the science, to lobby, to set up sort of false groups that lay out a different story, to deny, to obfuscate. And they've learned those tactics from the tobacco industry, and in some cases are using the same consultants the tobacco industry did. So it's, in some cases you need to talk. You need to talk, however, to the people who can make change. So you need to talk to your politicians. We want, the other thing that's really important is to think about how did that shift come about in tobacco? And I think that it largely came about because of a group here in Canada and others like it around the world, the Non-Smokers' Rights Association, who turned it into a rights issue, who said, I have a right as a non-smoker to breathe clean air. So the notion of the right to a healthy environment, I think, is a powerful tool for us. I have a right to not have pollution from fossil fuel burning or gas vehicle combustion engines. I have a right to live in a planet that isn't being heated by fossil fuel emissions. So we have to sort of use some of those same tactics that worked against tobacco against some of these other industries. And we also have to, in the case of the tobacco, the energy industries, the fossil fuel energy, we're still going to need energy. The need for energy doesn't go away. It's just the way we provide it changes. So we have to work particularly with the workers in those industries on what's known as the just transition. How do you help people move, and how do you help industries move from fossil fuel to clean energy? And how do you retrain workers? How do you help them to perhaps even physically move to a different community to earn a living still in an energy industry? So those are the kind of things we need to be thinking about. But I wouldn't try and preach to the unconvertible.
Yeah, thanks again, Trevor. We have a question here from Mariana, who asks, how would you suggest working with non-Indigenous communities who traditionally value capitalism and progress over preserving natural resources without creating cultural tension?
Well, I think that's one of the places where I think faith communities have a role. So I think there's a growing number of faith communities who in many ways, and certainly, you know, if you think about the conventional Christian churches, the Catholic Church, the Anglican Church, and so on in particular, but also it applies, depending which part of the world you are, Islamic communities or Hindu or whatever. But there are within those bodies of people who get this, and who get it because the Pope's encyclical around nature, for example, his recognition of nature comes out of his Franciscan tradition. Those kind of things I think are very powerful. And so one way to do it is to do that. Another way I think is to do what we're having, which is conversations. Help people to understand that capitalism as it's currently practiced is bad for health, bad for our well-being, bad for their future generations, their kids and grandkids, and help them to see that there are other ways to do this. I think you can tie that into Indigenous ways of knowing. I think you can use, if you're talking to the scientifically oriented, used the Gaia hypothesis of James Lovelock to say, this isn't some kind of new ageism. This is actually hard science as well as traditional knowledge. They both are saying the same thing. You've actually seen that in a somewhat different context there was a very famous book by Fritjof Capra about 40 years ago called The Tao of Physics, in which he linked sort of mystic and Buddhist and Hindu visions and other faith sort of based visions of the way the world is with quantum physics, and said, well, they're really just different ways of describing impermanence and uncertainty and all the rest of it. So those kind of linkages have been made in that field. I think we need to be making a similar sort of linkage there, or here rather.
Well, the next question, Trevor, is quite a lengthy one, so I'll, if you need me to repeat, I will. It's from Amelia, and Amelia asks, we in New Zealand are starting a major building program to create more social housing. Where would we find best practice for calculating embedded carbon impacts and overall ecological impacts? Is it true that concrete has high carbon costs, emits high carbon dioxide? Not too sure about that bit, but can repeat it.
Yes, good question. There's a huge wealth of material out there on green buildings. There are green building organizations and resources, and have been for 30, 40, 50 years all over the place. So we do know a lot about this. One of the things we need to emphasize is, you're right about the embodied energy, but it is in the steel and concrete, and there are alternatives. Wood, for example, wood is a stored carbon, and when you cut it down and use it in a building, it remains a stored carbon, and then you grow new trees. So you actually are embedding carbon in the building in a good way with wood, for example. There are other products, straw bale, and there are some modern materials that have very low ecological footprints. But if I go back to one of my earlier slides, 3/4 of the building footprint is in operating energy. So not only do you want to use low footprint materials, but you want to use low footprint energy sources. And so, for example, a friend of mine down the road is living in a new apartment building, and the heat source is ground heat through heat pumps for the whole apartment building. And so their energy costs are very low for a running cost. That's one of the things about renewable energy. Sometimes the equipment, the capital is higher, but the running costs are very low. And so you, over the life of a building, you save a lot that way, financially as well as in other terms. So you must have something like a green building council in New Zealand. So I would look to them as a first stop. I think the other point is, there is a tendency to think that if you're building social housing, you have to build it cheap. And that means you don't make it as energy efficient, because that's a capital cost, and you don't put in ground source heat pumps because that's a capital cost, and so on. That's a false economy. It actually, over the life of the building, is cheaper and better for people. It's also healthier for people than and certainly for the environment. So you have to invest a bit more upfront in order to get the benefits, but it's a false economy to think you should build cheap.
Thanks, Trevor. I think Aotearoa is heading that way in terms of housing, so it's good to see, you know, putting a bit more effort into putting heat pumps and stuff into our social houses. The next question is not actually a question, it's a comment. Our very own Dr. Viliami Puloka would like to make a comment. Over to you, Viliami.
Thank you, Lavinia, and also Trevor. Really, really very good, powerful talk you have done. I just simply wanted to thank you, and also just to recognize a couple of things that I think that it's very important for me as a health promotion person. one I think is so true. The point that you're making, in order for any of these things to happen, our thinking will have to change. Our consciousness have to change, and less homophobic, and be inclusive, recognizing the importance. And we are part of the planet, not the other way around. And the second point that I really like and I appreciate, and I hope others recognize that, your very practical advice for us health people to educate ourselves. This is such an important issue, and we need to know about it before we can even begin to spread the good news to others. So I think it's very, very important for us to educate ourselves in this topic. And the last point, I think, it's very important that you make the point that that we must be actively participating in our own community. Yes, this is a global issue, but we must be active locally while we're thinking globally. I think this is particularly important. And in that way, there are things that it's only appropriate for me to do here in Tonga. It's not going to be applicable for other places. Yes, there are wide implications of a lot of things, but in order for this thing to happen, we must know our community, we must be active in our community, and develop and work with the people who have for generations being the steward of all the good things that you've been talking about. So I just want to thank you very much, and just to raise those things. And I like the way you offer solution, especially for us health people, that we must educate ourselves and then involved in our own community. Malo apito.
Thank you, Viliami. And one thing I would add to that, I have said for years, as I was a very active environmentalist, one part of my history, I was actually the first leader of the Green Party here in Canada back in the mid-1980s. And so I've been very involved in that way. But I'm really, in many ways, an environmentalist before I'm a physician. And certainly I put the two together. But I have said for a long time, working as I do in public health and health promotion, that the environmental movement has been doing our job for us for the last 40 or 50 years. That health promotion, that public health has not been there. That environmental health for public health has mainly meant toxicology and epidemiology and pollutants and a very narrow view of what constitutes environment. So they weren't talking about climate change or species extinctions or resource depletion or ocean acidification or any of those things. Who was talking about it? The environmental movement. And so 2 points. The first is, if you go to your local environmental organizations, they will be thrilled to have a health voice join them, to have someone stand up from the health sector and put the health case for why we should do what they've been advocating all these years. And the second thing is that they have got a great body of work and contacts and resources already. We don't have to reinvent that. We have to be a little humble, because there's a tendency for us to go in and say, right, we're here, we're going to show you how to do this. They've been doing this for 30 or 40 or 50 years. We need to go in somewhat humbly and join them in their work, not get them to join us in our work.
Thank you, Trevor. There's no more questions. So over to you, Sione.
Well, firstly, thank you to those who have asked those wonderful questions and, enable Trevor to say more and share his experience and expertise. And thank you, Viliami, for those confirming comments. And I agree that there are things specific to certain national contexts in Tonga, but remember, you're only visiting. We'd like you to be back when things are okay. We need you here in Aotearoa.
So in that case, maybe I could add one other thing. I did have a question for you folks. Do you have a coalition for green healthcare or something like that? In that case, I see Lavinia shaking her head. In that case, you might want to think about getting one set up, because it is a way to have this conversation with the healthcare system, and particularly with those who are not in public health or in health promotion, but who are in the bulk of the profession that's in clinical care of some sort. I don't know if you have anything like the Canadian Association of Physicians for the Environment or the Canadian Association of Nurses for the Environment. I know they have them in Australia, but if there's nothing there, look around. I should probably have looked around before I came on the call, but I didn't. But check it out. If there isn't, then look to Australia or Canada or the US, look to Healthcare Without Harm, which is the international organization, because there is a very large body of work, and certainly in terms of talking to our colleagues in the rest of the health system, because, for example, Canadian Association of Physicians for the Environment, mostly they are clinicians. And so when they show up, and in some cases show up in their white coats to talk about climate change, it has an impact. It has a media impact. It has a public impact. So getting them involved, getting them on side, getting them as allies is powerful, but also getting the healthcare system to look at itself. So what's its energy use and where's the source of that energy? What sort of food is it serving? I mean, hospital food notoriously is not very healthy. Well, what's wrong with this picture? And how about organic local food? Our ministry here has mandated our hospitals to source 30% of their food locally. That's an interesting thing to have happening. So it may be worth checking that out if you don't have anything like it.
Thank you for that, Trevor. I have a question, but I'll make a brief comment on that particular item. I think the dots are beginning to join. There is Ora Tao, which is a human health and environmental group. There are a few physicians, as well as working very closely. I have invited, there might be some members of Ora Tao here. Our global working group is part of that, lifting the gaze to the and learning from the international level, sharing experience like yours. We are running our own courses, incorporating planetary health and the environment and all of that. It's part of moving towards that point. But I think your suggestion is very timely for us, and we should be all looking, towards that to join the dots a lot faster than before. There are colleagues in the public health sector here. There are also colleagues in the education sector who are with us today, and there are some practitioners out in the field, public health and health promotion, and there are also colleagues from the city councils around the country here. This might be the starting point. But perhaps my question then, briefly tell us, how did you go about doing that?
Doing what?
Your Green Coalition,
Well, the Canadian Association of Physicians for the Environment really began with just three of us. Three of us having a conversation. We'd hooked up because, I don't know, one finds one's allies, I guess. And one was a family doc called Warren Bell, who's here in BC. I was in Toronto at the time as a public health physician. And the third was T. Guidotti, who was an occupational health, occupational environmental health professor. And I guess because we were going to the same events, we found each other, we started to have this conversation. We were all three of us interested in the need for what became the Canadian Association of Physicians for the Environment. And so we just created it. We just started it. We started to write about it, talk about it. We set up a society with the three of us as, of course, as the first officials. We found others, we created a board and so on. And 25 years later, it's a very active organization with significant impact. The same applied I guess, to the Canadian Association of Nurses for the Environment. I wasn't part of that, but much the same. It's always that Margaret Mead quote that everybody uses, that never believe a small group of people can't change the world. It's the only thing that ever has changed the world. And so that's what we did. Same for the Canadian Coalition for Green Healthcare. What happened there is that there were the Canadian Association of Physicians for the Environment was interested in the environmental impact of healthcare. Environmentalists were interested in the environmental impact of healthcare because they were interested in particular in the problem around disposables, but also energy use. Hospitals, by the way, are outside of heavy industry, are the most energy intensive facilities in our communities because they have to maintain a steady temperature 24/7, regardless of the outside temperature, because they have a lot of heating and cooling and air conditioning, because they use a lot of high energy things like CAT scanners and MRIs and so on, X-rays. So they're very energy intensive. So those two groups were interested. And again, we sort of found each other because we were in the same rooms having the same sorts of conversations. We organized a workshop on the environmental impact. And of course, we also knew about the US, what started in the US and became global, healthcare without harm. And we knew that they were already doing it in the US, so we had a bit of a model. So we held a workshop, and out of the workshop, we decided to create the coalition. And what helped was we were able to persuade the Ontario Hospital Association, which is the largest hospital association in the country, to let us work with them, which we did over several years. In their conferences, they set up an exhibit lane in their exhibits that was for green healthcare, where people who had products or services that were more environmentally friendly could show their products and services to hospital executives and managers and so on. So yeah, it happened. Still going strong 20 years later.
Wonderful. Thank you. Lavinia, just final check whether there are any more questions.
Yeah, I've been going through the questions. No more questions, Sione. So I've got some nice comments though, thanking Trevor for your fascinating and important discussion. And thank you. This is wonderful. And Trevor, you're a wonderful speaker.
And yes, you can ask me anything. I just may not answer.
Trevor, on behalf of the Health Promotion Forum, our participants for today, express our sincere gratitude for your wonderful, very knowledgeable, lots of practical solutions for the challenges that we face as a world community. And of course, as you said, this is an extension of our global working group to share the message of the urgency of addressing the health of the planet as part of addressing also our human well-being. And this is the ongoing work that we started here in Aotearoa, New Zealand, in Rotorua, 2019. At a conference, I made it clear that we have come to a point in our social evolution as humanity that we are one people, one world, one health. The world is but one country, and humanity, its citizens, and it's about time that we work together. I hope this is not the last. It would be a phase in a series of our collaboration. And thank you again. And to our participants, thank you for joining us today. That is the end of our session.